Good day, everyone. Thank you for joining me today. My name is McCloud, and I am a psychiatric nurse practitioner and DNP student at Maryville University. Today, I will present my quality improvement project titled Improving No Call, No Show Rates in a Rural Primary Care Practice Using Text Message Reminders. This project focuses on reducing missed appointments, commonly known as no-shows, in a rural primary care setting by leveraging text messaging technology. On this slide are my committee members. My chair is Dr. Joanne Kern. My second reader is Dr. Boniface Stiegman. And my community member is Dr. Melissa Waybrant Ennis. This project's purpose was to evaluate the effectiveness of text message reminders for reducing no-show rates among adult patients age 19 to 65 years of age in a rural Florida primary care setting. Missed appointments, often termed no-shows, are a persistent challenge in healthcare, particularly in rural primary care settings. Nationally, no-show rates can reach 15 to 30% of scheduled appointments, disrupting continuity, decreasing provider productivity, wasting clinical resources, and causing significant financial losses for practices. In rural clinics, these problems are magnified because patients typically face hurdles such as limited transportation options, lower health literacy, socioeconomic constraints, and reduced access to technology needed for modern reminder systems. The clinical consequences for patients are severe. Missed appointments lead to poor chronic disease management, higher rates of emergency room use, and ultimately worse long-term health outcomes. For providers, recurring no-show result in underused appointment slots and scheduling gaps that could otherwise serve patients in need. These operational challenges directly affect the ability of a clinic to provide timely preventive services and can strain healthcare systems already grappling with workforce shortages and limited capacity. Existing literature reveals that digital interventions, especially text message reminders, can reduce no-show rates, but most prior research has focused on urban, well-resourced populations or lacked rigorous evaluation in rural communities. The digital divide means that some rural patients still lack reliable access to cell phones or broadband needed for such solutions. This project was therefore designed as a pragmatic response to local gaps, aiming to quantify the impact of timely text messaging reminders on patient attendance in a rural Florida practice and to address underlying barriers unique to this population. To inform this effort, the author conducted comprehensive literature reviews in PubMed, Embase, and the Cochrane Library using terms related to primary care, appointment reminders, and no-show rates. The author included studies published from 2019 to 2024 that explored appointment reminders and no-show rates among adults in primary care. The inclusion criteria included articles published from 2019 to 2024, written in English language. They focused on adult patients, methodological rigor, direct relevance to text message reminders in primary care, and applicability to the project's population and setting. Abstracts of initially identified articles were screened for relevance. Duplicates and studies failing to meet quality or applicability standards were excluded, and the final selection resulted in 14 peer-reviewed articles grouped by themes and directly supported the intervention. Three key themes were the central focus of this project. First, looking at prevalence and impact, research shows that up to 30% of appointments are missed, which leads to disruptions in care and even financial loss, especially among rural and underserved communities. Next, for barriers to adherence, there were several factors that played a role. Those factors included socioeconomic issues, transportation difficulties, forgetfulness, gaps in health literacy, and limited access to technology, all contributed to high rates of missed appointments. These challenges tend to be even more severe in rural settings. Finally, regarding interventions, there were several studies that found that digital reminders, particularly text messaging reminders sent 24 hours before an appointment, help reduce the number of no-show rates quite reliably. The health belief model served as the guiding theoretical framework for this project. The health belief model is a well-established model in health psychology and public health designed to explain and predict health behaviors by focusing on individuals' beliefs about health conditions and interventions. So there are several concepts that relate to this model. The first one is perceived susceptibility and severity. The intervention strategically raised awareness of the health risks and consequences of missing appointments and encouraging patients to view attendance as essential for good health, especially for chronic disease management. Perceived benefits details reminders reinforced the tangible advantages of keeping scheduled appointments, such as maintaining continuity of care and preventing complications. Perceived barriers entails the project's acknowledged practical obstacles, forgetfulness, transportation difficulties, privacy concerns, and sought to reduce these with timely text reminders. Cues to actions that entailed sending SMS reminders served as direct cues promoting patients to take action in real time and making attendance a more immediate priority. And lastly, self-efficacy entailed clear supportive message wording aimed to boost patient confidence in their ability to attend appointments regardless of external changes. Incorporating the model into this project ensured that the intervention would be both relevant and effective for the target population. It influenced the formation of message content, timing, 24-hour reminders, and strategy addressing the barriers identified in the rural clinic context. The curated diagram visually mapped the connections between patients' beliefs, perceived barriers, and positive influence of reminders, providing practical clarity for staff and stakeholders. This visual approach helped secure buy-in and facilitated smoother implementation, reinforcing the value of theory-based quality improvement in real-world practice. So again, to clarify, the diagram in this slide was created by the author of the study to reflect those core concepts that were previously mentioned and the pathways of the health belief model as applied to the patient appointment adherence. This project used a quantitative comparative quality improvement design supported by a retrospective chart review. By evaluating no-show rates before and after implementing 24-hour text message reminders, the methodology allowed for rigorous statistical comparison of binary outcomes, whether patients missed or attended appointments. This approach directly supported the validity and reliability of the findings by objectively measuring the impact of the intervention. The pre-intervention group included 77 patients, as did the post-intervention group. The inclusion criteria for the sample were adult patients of rural Florida primary care practice, specifically those aged 19 to 65, who had a scheduled appointment between December 2024 and June 2025, and who had access to a mobile phone capable of receiving text messages with a valid mobile number documented in the EMR. The exclusion criteria were any patient younger than 19 or older than 65, those without a mobile phone or unable to receive text messages, and patients who had only email, or phone call set as their notification preference. These criteria ensured the sample reflected the population who could directly benefit from the text messaging intervention and maintain focus on the project's target demographic. The project used two main statistical tests, as you see on this slide: the z-test for the difference of proportions and the chi-square test. These tests were chosen because the primary outcome, patient attendance versus no-show, was a binary variable, allowing for a straightforward comparison of pre- and post-intervention groups. The z-test for the difference of two proportions evaluated whether the reduction in no-show rates after implementing text message reminders was statistically significant. The test is well suited for comparing two independent groups on a categorical outcome. The chi-square test was also used to confirm the statistical significance of differences between the groups, 24 hours versus 3-day reminders, providing additional validity for the findings. The chi-square test is commonly used for categorical data to determine if there is an association between the two variables. These analytic choices ensured that the project's quantitative comparative design accurately measured the impact of text message reminders on appointment adherence, with strong statistical rigor supporting the reported outcomes. The project results showed a substantial improvement in patient appointment attendance after implementing 24-hour text message reminders. The no-show rate dropped from 72.73% to 16.88%, reflecting a reduction of 55.85% over the 12-week intervention period. These changes were confirmed by statistically significant findings of a p-value of 0.0001 with an achieved power of 1, indicating strong analytical reliability. In detail, pre-intervention was 72.73%, and no-show rates, only 27.27% attended appointments. Post-intervention, 16.88%, no-show rate, 83.12% attended the appointments after the 24-hour reminders. The reduction was statistically significant and demonstrated by both z-test and chi-square analyses, confirming the effectiveness of timely text messaging reminders for improving attendance in a rural primary care setting. The intervention achieved a statistically significant reduction in no-show rates, with attendance improving from 27.27% before to 83.12% after implementation, representing a 55.85% decrease in missed appointments following the use of 24-hour reminders. The statistical power achieved was 1, indicating strong reliability in results. The use of a retrospective chart review minimized recall bias and ensured objectivity in data collection, while the outcome measure was a quantifiable reduction in missed appointments, was clearly aligned with the project's goals. Integration of behavioral theory by the health belief model into the intervention design enhanced the ecological validity and facilitated understanding of contextual factors affecting the patient's attendance. The collaboration between clinic leadership, staff, and IT support enabled seamless integration of reminders systems into the existing workflows, illustrating feasibility and sustainability in rural practice. Ethical compliance was ensured through IRB oversight, and all data were de-identified and protected the patient's confidentiality. The study's single site rule focus limits the generalizability of its findings to other clinics or urban settings. Broader studies would be needed for robust external validity. Reliance on electronic medical records meant potential issues with data inconsistencies or missing information, although these were minor and did not substantially affect the results. About 7% of patients lacked reliable phone services, which caused disparities in intervention reach. This digital divide is a persistent challenge in rural healthcare. Additionally, a 5% opt out rate from privacy concerns and a 23% surge in same day rescheduling due to reminders increase administrative burden. The intervention unintentionally strained clinical resources as increased attendance and rescheduling requests temporarily overloaded staff and appointment capacity without corresponding increases in staffing. This intervention demonstrates that text message reminders are not only feasible but highly effective in rural settings. Clinics can use similar strategies to optimize resources, improve continuity, and deliver better patient outcomes. Standardizing SMS reminders and integrating with clinic EMRs are recommended next steps, as is addressing technology and access barriers to promote equity. Implementing 24-hour text message reminders in a rural primary care practice had several important implications for practice, patient care, and the healthcare community. For daily practice, this intervention significantly reduced missed appointments by 55.85%, freeing up staff time, optimizing the daily schedule, and reducing wasted resources. For patients, more consistent attendance meant better continuity of care, timely management of chronic health conditions, and increased satisfaction due to convenient, reliable reminders. For the healthcare community as a whole, successful results offer a scalable, cost-effective model that can be adopted by other resource-limited clinics. This helps not only operational efficiency, but also overall population health by reducing gaps in preventative and follow-up services. Additionally, integrating technology for appointment reminders supports health equity, especially in underserved areas, and provides policymakers with strong evidence to advocate broader digital health solutions. Clinics using similar systems may also see reduced financial losses and smoother workflows, all while maintaining ethical standards and focusing on improved patient outcomes. In summary, this project supports broader adoption of digital reminders, particularly where access barriers are high and resources are limited. The intervention was a springboard for further innovation in health technology and public health. Key areas for future work include customizing message, timing, and content, scaling up to a larger population, and integrating reminders into broader preventive and population health initiatives. So overall, this project demonstrated that 24-hour text message reminders dramatically reduced no-show rates in a rural primary care setting, improving appointment attendance from 27.27% before the intervention to 83.12% after, a change of 55.85%. This proved timely digital reminders are a practical, cost-effective solution for enhancing clinic efficiency and continuity of care in underserved communities. While the intervention was highly effective, it did face some limitations. Challenges included a 7% digital access gap among patients, privacy concerns resulting in a 5% opt-out rate, and a temporary administrative burden caused by a 23% surge in same-day rescheduling requests. If repeated, future work would emphasize solutions like multilingual messaging, more robust patient outreach, automated rescheduling, and expanded staff capacity to manage increased appointment attendance. Moving forward, plans include ongoing audits, sustained training, collaboration with technology partners, and sharing findings for broader adaptation in other rural clinics. The DMP program personally strengthened leadership, project management, and evidence based practice skills, revealing the value of behavioral theory and quality improvement for patient centered care. This journey fostered a deeper commitment to health equity and innovation in clinical settings. Thank you, everyone, for listening and for your time and attention.